change. You'll be waiting every single day. It will never happen if you won't take responsibility for the change that you want to see. It's your right to be heard. You gotta get up and go and do something. You gotta get up and fight for something. You gotta get up and shout for something. You got a right to be heard. You gotta get up and go and do something. You gotta get up and fight for something. You gotta get up and shout for something. You got a right to be heard. No justice, no peace. No justice, no peace. Free, no peace. That is what we all long to be. No peace. Free from this unjust society. No peace. One day it will happen. No peace. No justice. No peace. If we find a voice for our community, shout, march, stand in unity, then we will be heard. Gotta get up and go and do something. Gotta get up and fight for something. You gotta get up and shout for something. You got a right to be heard. Gotta get up and go and do something. Gotta get up and fight for something. You gotta get up and shout for something. You got a right to be heard. No justice, no peace. 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 Gotta get up and go and do something. Gotta get up and fight for something.
Okay, I guess we're live. Good afternoon, everyone. Just want to get a confirmation that we're ready to start. Ready to begin? Yes. Okay, great. Hi, everyone. My name is Kimberly Sales-Allers, and welcome to the Mobilize Maternal Health Coalition press event and live stream. What an important time for us to be gathering together to have these conversations and to really figure out a path forward for mobilizing for action. I am the executive director of Narrative Nation. We are a New York City-based media and technology nonprofit, and I'm the founder of the Irth app, the number one place where Black moms go to leave ratings and reviews of their maternity doctors, hospitals, and pediatricians. We use that data to work with hospitals across the country and create quality improvement plans rooted in Black and Brown voices. And I'm so excited to be here in support of the Mobilize Maternal Health Coalition. One thing that is super clear right now is that now more than ever, we need each other, and that coalitions are truly needed. When we look at the calculated chaos that's going on around us, we must be clear that the only way through is together and by locking arms and literally saving ourselves. And that means using all the tools in our arsenal, whether that's technology, advocacy, community building, and yes, policy. And we need to do that right here in New York, in my home state. I like to let everybody know I'm a born and raised New Yorker. I'm a queen from Queens. It's in my Twitter profile. I'm a proud product of New York City public schools, and I went to NYU for undergrad and then Columbia. So I'm a real New Yorker. New York made me, right? And so this is my home. What's happening here impacts me, impacts my children and my children's children, right? And so this is such an important conversation. But one thing we know about the policies that we need to create going forward in our state and even beyond our state, they must be connected to people. And we can't forget this, right? The people that we intend to serve, not just as reviewers of the policy, but as ideators, as co-creators, to be at the table from the very beginning, helping to create these policies so that we know that they're rooted in real community voices and that they are actually going to impact people. In our work, lived experience matters, right? It's not just about being able to access care, but the experience of that care is what's really important. When we look at the issue of maternal mortality and morbidity, it is not okay that we don't die, just die. We need to survive. We need to thrive. We deserve a 5-star experience, right? And so, how do we make sure that the lived experience of a policy, not just the stated version of it, is also very much part of what we're pushing for? So I want to invite folks to think about that as we think about and learn so much today about the various policy initiatives. And then we must be thinking about policies all the way through, and I mean through to implementation. Let's be honest, too many elected officials get bragging rights for policies that exist on paper, um, but have barely even hit the people. Maybe folks are not getting paid. Maybe the impact has yet to reach a community level. And so we can't have policies that are only on paper and never make it to the streets, never make it to the community, and don't have the impact. And so when we're thinking about policy, let's also remember about implementation. How is that policy going to be implemented, and to see that thinking all the way through? So our policies must go beyond paper wins, so that they are truly people wins and that our community benefits from our policy advocacy efforts. And this is why the Mobilize Maternal Health Coalition is so important. I come to this work as a journalist by trade. I'm a former writer at Fortune magazine and senior editor at Essence, and the author of about 5 books. And so I'm a word girl. And so when we think about the Latin root word of the word, the Latin roots of the word mobilize, it actually means movable or easy to move. And then around the 18th century, the French meaning became to render movable, to prepare for action. And then later on, as this word kind of grew and as language does, it evolves and it changes. Around the 19th century, when it was first recorded in the English language around the 1830s, it was really used in a military sense to mean preparing troops for movement or action. And that's where I'm feeling its etymology right there, preparing troops for movement or action. Because quite frankly, that is why we are here today, to prepare for action, to prepare for policy action, to first learn so that we can be better equipped for action, and to render something or some state of things as able to be moved, right? We have to believe that it is able to be moved. And so we are here to action, to move what we know is movable, and to push for the change that we know that birthing families all across the state deserve. You, like me, may have been thinking a lot and seeing perhaps a lot on your social media, the reminder that came from Toni Morrison and one of her quotes that talked about the function of racism is distraction. The function of racism is actually to distract, to keep you looking at all the other things, to keep you busy trying to prove yourself, to say you're worthy, to say you have value, to say this work matters, but distraction from the work. And so, again, in this environment where there are so many fires, so many things that we can be distracted from with this intentional chaos designed to distract us, today is a day for action, not distraction. And so I invite you all to listen such to the amazing speakers that are here today, learn about the policy efforts that are already underway and what you can do to support it, and to resist distraction and be ready for concrete action. Thank you.
Thank you so much, Kimberly Sears-Allers. You are such a gem in this work. You've inspired me for over a decade now from the work that I've been privileged to receive and work with you and alongside and follow in the footsteps. And you are really anchoring when it comes to the etymology, and that's what we're here for. So with that, I appreciate you, and we will continue forth with this event, this virtual press conference to announce our Empowering Reproductive Justice campaign. We want to address the urgent healthcare needs we have here in New York. We're organized by a number of people who've come together, reproductive justice organizations, public officials, leaders, advocates, and we are the Mobilize Maternal Health Coalition. And some of the initial conversations began, let's acknowledge the work that has been going long before we got here and give a nod and a thanks to all those who have done the work. And so in this iteration, we came together in October with an open call to folks who have legislative priorities, things they want to co-elevate that have anything pertaining to maternal health in New York State. And we listened to the various bills, the various initiatives, and we found that a commonality that we're wanting to uplift with these initial stakeholders, including PUSH, the New York State Birth Center Association, the New York Certified Professional Midwives, Birthing Place Foundation, Save a Rose Foundation, others. You guys are really helping to elevate what we can demand, what we can express to our community to get them involved, aware. And we also want to urge our legislators to pay attention in a way that the consumers, the people, the folks who this affects personally and the generations to come are invested in the solutions that we hope to serve on a platter for our folks, our decision makers, our lawmakers to take action on bills related to maternal health care. So that is why we're here. That's who we are. And today I am representing, my name is Myla Flores. I am a birth worker for going on 18 years now, the executive director of the Birthing Place Foundation, which has just evolved in a sweet way to amplify various maternal health programs within the Bronx and expansion to hopefully lead to other birth centers and creating more access. Today, I would like to represent as the president of New York State Birth Center Association and acknowledge that there is a status right now when it comes to New York State and birth centers. And so I want to update people with that status. And I also want to just acknowledge that there are ultimately financial and regulatory barriers that out of hospital birth are facing, be it midwifery access, the workforce, be it the actual development and creation of birth centers. When it comes to the organization, New York State Birth Center Association, our 24 members, 8 to 11 identify as developing birth centers, and many of which are in momentum or already serving people in different ways as birth houses or what have you. Our state actually only has a couple licensed accredited birth centers. And since that bill that was passed in December 2021 permitted legally that midwives can open birth centers, there hasn't been implementation. And so this isn't to necessarily point fault or blame. We know that part of it might be like true efforts, part of it might be a lack of priority. And so our hope is to elevate what is present and take a snapshot of what that is, our chapter is going to meet, we're a chapter of the American Association of Birth Centers, and we're going to meet in March and identify what our legislative priorities are. There's a range of possibilities here. Ultimately, we would love for our bill, the one that we introduced and passed unanimously through the Senate and Assembly in 2021, to be acknowledged as the true way we move forward when it comes to licensure and accreditation of birth centers in New York, because that in and of itself would permit many birth centers to open. Thankfully, our birth center that we're working on in the Bronx has the ability to open, but with the old iterations of licensing here in New York. And so unfortunately, that relies on a medical director, an MD, and in a way that is imbalanced in it isn't permitting the many midwives who are actively and who were excited about a bill passing and who are actively moving forward in hopes to have sustainable birth centers when they open. We need that licensure factor so that we can have the permissible insurance reimbursements, so that we aren't then put under the difficulty of sustaining the birth center ecosystem that aims to support our community. So in the effort of keeping this short and sweet, I want you guys to tune in to a teach-in that has happened, and there will be more teach-ins to come from the Mobilize Maternal Health Coalition, so stay tuned for that. And I will go ahead and introduce one individual who can't be here today, but she has a reader in place who is also a member of the New York State Birth Center Association, Holden, reading on behalf of Coit House Birth Center. Licensed midwife Mara Winkler is really holding down the fort there in an amazing way and serving so much of her community. So Kim, would you read one birth center's story? And mind you guys, 18 individuals submitted their stories on what their obstacles were in licensing their birth center, and this is just one. So take a listen.
Thank you so much, Myla. I'm honored to be here and to read a little bit about Maura's story. I'm a certified nurse midwife who applied for birth center accreditation with the Commission for Accreditation of Birth Centers, CABC, and licensure with the Department of Health, DOH, in 2020. Despite being accredited by CABC in 2021 and reaccredited in 2024, I've been unable to obtain licensure from the DOH. My birth center, the Coit House in Buffalo, New York, is the only option for out-of-hospital birth in my community and serves clients from a 2 to 3 hour radius. Achieving accreditation twice, yet being denied licensure, indicates a malfunctioning licensure process in New York State. The DOH has publicly maligned my birth center, implying safety and quality concerns that don't exist, given I have achieved and maintained the gold standard of accreditation. Denying licensure in the name of safety is illogical. If the DOH prioritized licensure, they would regulate birth centers and create safer birthing spaces. The Coit House serves a diverse population, with 40% identifying as BIPOC and 70% as Medicaid managed care recipients. By denying licensure, the DOH has diverted resources away from a community needing high quality midwifery care and deprived the birth center of facility fee reimbursement, threatening sustainability. Thank you, Tamara.
Amazing. And so we also have a form that is going to be available in the post that we'll put underneath the video, so that people, if there are stragglers of folks who have ever attempted to open a birth center or are currently in progress, we want to know who you are. We want to be connected. We want to work together, because it is being together that allows us to have a stronger voice when it comes to insurance reimbursements and the value-based models that we want to be within when the time comes. So we're not getting pennies for the valuable service that we'll be offering. So let's stay tuned for that at some point. And now I'll introduce Vanessa Gibson, and who's been really gorgeously supported by Manor Jara. Bronx Borough President Vanessa Gibson has been showing up to our womb bus events, to our opening of Mariam Reproductive Health and Wellness Clinic, and has worked with her team to create a birth center report that basically has enabled, or hopefully when it comes out, will reach more of the people and the information. Let's see here if she is in the room. So we're going to go to our dear friend and CPM. So maybe there's some technological glitch. I just want to give a shout out to an event that I know is happening right now that Vanessa was going to step away from. It is a national hijab awareness. And so I saw that the borough president was organizing something in that way to honor Muslim and Islamic culture when wearing the hijab, and sharing with the community more about the context and honoring that. So Tisha, thank you for being here. I want to acknowledge Tisha as a CPM advocate who wants to share with us the issues around licensure. And remember, we're all here to learn about the issues. We're going to talk more about solutions and how to get involved. So Tisha, would you please take it away with how CPM licensure creates critical solutions to New York's maternity crisis, and share about the bills, anything you'd like to in this couple minutes.
Thank you so much, Myla. Thank you, everybody, for having me. It's an honor and a privilege to be here. Hello, fellow visionaries, and welcome to the virtual press event of Mobilize Maternal Health Coalition, and welcome to the movement. We are giving birth to a movement that is going to impact maternal health care across the state in many, many different ways. We're starting something big, and it's great to have everybody along. My name is Tisha Graham. I am a certified professional midwife, and I'm representing New York CPMs today. We have a bill that for several legislative sessions now has been working its way through the processes, through the Assembly, through the Senate, and through the powers that be. Our bill is called the CPM licensing bill. We have an Assembly number, Assembly 1125. We're waiting on a new Senate number. Each new legislative session, we get new numbers to identify our bills as they work through both houses. And so we'll keep everybody informed as to what those numbers are and how you can support the bill's movement toward being signed and being recognized. So, NYCPM has a lot of really broad bipartisan support for this bill. CPM, certified professional midwives, are the only midwives, the only credential of midwives that specialize, that are educated, specifically trained and specifically credentialed in out of hospital birth. That is our area of expertise. We need licensure in order to bring our expertise into the communities who seek our services. Currently, certified professional midwives are not legally recognized. In fact, we are criminalized for the work that we try to do within our communities. And what we're trying to do is really just protect the birthing rights of the many families across the state who choose out of hospital birth. And the reasons, of course, that people choose out of hospital birth are very varied. Number one, there are very many communities. In fact, there are 20 counties across the state of New York in which there are 0 maternity care services. We don't have any obstetricians. We don't have any hospitals, any midwives, any clinics in as many as 20 counties across the state. So we have a real maternity care desert situation. And licensing CPMs will decrease those gaps in maternal health care and will increase the maternal health care workforce in New York. Obviously, another reason that we are all very, very painfully aware of is that Black and brown birthing families may want to avoid going into a hospital for birth because their chances of surviving that birth in a hospital are far less likely than their Caucasian counterparts. I mean, we know the numbers, we know the stats. We've heard the heartbreaking stories. We know that Black and brown birthing families are seeking alternatives to the hospital situation, and they are seeking home birth services, and certified professional midwives, once licensed, will be able to serve women in their own community, culturally competent care. And that is obviously a very big reason that we need, and we will eventually have licensure in New York. In addition to Black and brown birthing families, we have many religious communities across the state who seek out-of-hospital care from the midwives in their own communities, Orthodox communities, Amish, Mennonite, Plains communities, many other communities, Muslim communities, where women typically do not go into the hospital for birth, and their standard of care is out-of-hospital birth, with the midwives in and from their own communities who have served them for generations. And those midwives, many of whom are certified professional midwives, cannot gain licensure or legal representation, legal status to be able to serve their own communities. Home birth is really a growing option in the state of New York, really since COVID. Home birth has increased in 20%, by about 20%, and it continues to grow. There seems no end in sight for the growing number of families who are seeking out-of-hospital birth support, that support that CPM specifically provide. And, finally, as Myla spoke about, we are about to have midwife-led, midwife-owned, midwife-run birthing centers all across the state. That's our goal. That's our vision. And certified professional midwives are specifically trained and will be able to staff those midwife-led birth centers in addition to continuing to provide support for families who choose to birth at home. Finally, I'll just make a very quick announcement and a very quick plug that one of the teach-ins, in fact, the next teach-in that we have scheduled for February 25th at 12 noon on this very station, brought to you by the Mobilize Maternal Health Coalition, is the how CPM licensure creates critical solutions to New York's maternity care crises. And we'll have an in-depth conversation. We'll have some slides, we'll have some speakers, and we'll really take a deep dive into looking at the ways that CPMs serve and work, but also what we're doing in New York to make sure that we can secure licensure within this legislative session. So thanks so much, everybody. Looking forward to seeing you again.
Amazing. We're looking forward to that teach-in on February 25th. And now I'm going to introduce Marlene Nunez, a wonderful health educator, reproductive justice advocate, full spectrum doula, who has worked with many youth that I've been witness to the way that you inspire the people around you and you care for them. And I thank you for being here to give testimony on how this CPM licensure affects you as a perspective and working towards a midwifery license yourself.
Yes, thank you so much, Myla. I'm honored to be here in support of the Mobilize Maternal Health Coalition. My journey to midwifery began with my sister's traumatic birth experience in 2013. At just 13 years old, I witnessed firsthand the disconnect between her and the medical staff. I recognized barriers in her healthcare that I now know stemmed from a lack of culturally affirming care, resources, education, and accessibility. This later sparked my passion for midwifery, particularly in a community-based setting. As I delve deeper, I've realized the midwifery model centers individualized, culturally competent care, something lacking in traditional healthcare settings. My research and undergraduate studies solidified this commitment to this path. In 2022, I was accepted into a midwifery program. I was overjoyed to begin my journey to supporting my community. However, I soon discovered that New York State only licenses certified nurse midwives and certified midwives, not certified professional midwives, which have a specific focus on community-based births. Pursuing this midwifery program meant that I have to uproot myself to pursue my dream. I considered completing my clinical training in Texas, but ultimately decided against it due to financial constraints, the landscape of CPM licensure in New York, and the overturning of Roe v. Wade. Currently, I work with Children's Aid as a sexual and reproductive health educator, supporting Bronx and Harlem youth in accessing LGBTQIA+ inclusive reproductive care and learning medical self-advocacy. Although my midwifery journey was paused, I'll continue advocating for radical change in New York's healthcare system. Community midwives deserve recognition, and licensure is crucial for birth equity and justice. I'm committed to mobilizing for legislative action and supporting fellow community members in this fight. I hope that one day I, along with other culturally competent, aspiring midwives local to our state, can have accessible pathways to becoming the midwives our community deserves. Thank you so much.
Wonderful. Thank you so much, Marlene. I know far too many people who have similar stories, and even more who have left our state as they pursued a really important credential, certified professional midwifery, and they've unfortunately had to bring their valuable contributions to other states. It's really sad, but I hope that all of us hope that you one day will pursue this path that permits you to serve your community, which you have rooted so beautifully within, and they deserve you greatly as a midwife. Next up, I will introduce a wonderful, I can't even put enough words to the appreciation that I have for Samantha, Executive Director of PUSH for Empowered Pregnancy. I participated in similar events and have seen the work that she is really rallying up around her and the importance of the stillbirth crisis in New York, which often gets left out. And so, Samantha, would you please share more about who you are, what you're up to, and give an intro to everyone about the legislation that you want to uplift today?
Absolutely. Thank you so much, Myla, for the intro, and thank you to everybody who is here today. As Myla said, my name is Samantha Banerjee, and I'm the Executive Director of PUSH for Empowered Pregnancy. We are a national 501c3 nonprofit based right here in New York, and we are dedicated to ending preventable stillbirth in the United States. I am also mom to Alana, who was born still in 2013, just 2 days before her due date after an otherwise normal and healthy pregnancy. And she was one of 65 American babies born still that day and every single day since. Like my Alana, most of the approximately 1,300 babies lost in New York to stillbirth each year are healthy. In fact, 80% of stillbirths are taking place in pregnancies that start with no known maternal risk factors. However, most parents never hear the word stillbirth until it happens to them or someone they love, even though it's claiming more U.S. children's lives each year than prematurity, SIDS, car accidents, drowning, guns, fire, poison, flu, and listeria combined. So PUSH is a proud member of the Mobilize Maternal Health Coalition, and here today to raise awareness not just about stillbirth, but also about New York's inhumane revocation of paid family leave after a baby is born still. Defined as taking place after 20 weeks gestation, stillbirth means that the baby who has died must be born just like any other, leaving stillbirth moms with the very same postpartum conditions. As we know, the postpartum period is one of the most dangerous times for birthing people, particularly for BIPOC families. Black women in New York State are 3.5 times more likely to lose their lives than white women due to complications of pregnancy or childbirth. And in New York City, they're 9 times as likely. 60% of maternal deaths take place in the postpartum period, with 2/3 of those happening in the 6 weeks immediately following birth. That's the exact period when New York stillbirth moms are being stripped of their leave. Black women are also more than twice as likely to suffer a stillbirth, and all stillbirth moms are almost 5 times as likely to experience severe, potentially life-threatening maternal complications. This means that stillbirth is, in a very real way, putting the lives of New York mothers at risk, and this burden is being disproportionately shouldered by families of color, though it can and does happen to anyone. Here to share more is Cassidy Perrone, mom to Olivia, who's been leading the fight to fix this dangerous and cruel loophole in New York's paid family leave law.
Thank you so much, Samantha. And I just want to thank all of you for being here and for putting maternal health first. And I really want to thank Push Pregnancy for coming alongside me in my darkest hour and fighting every day with me tirelessly. As Samantha stated, my name is Cassidy Perrone, and I am the mother of Olivia, who was born still on March 17, 2022, at 36 weeks gestation. After 17 grueling hours of labor, I walked out of that hospital devastated and empty-handed. The day after her funeral, I received a call from the state of New York asking me to voluntarily withdraw my previously approved paid family leave application because Olivia had passed. I refused because I had been relying on that nearly $1,100 a week in paid family leave to recover postpartum for nearly 9 months of pregnancy. And as the primary breadwinner in my household, I was forced to make the unthinkable decision when they revoked my paid family leave to either follow the medical advice of my doctor to take a minimum of 6 to 12 weeks unpaid leave or pay my mortgage. I was either going to have to take unpaid leave or go back to work and pay my mortgage. She informed me that even if Olivia had lived, she could not write me back into work because of how dangerous the postpartum period is, especially being a stillbirth mother and being 5 times more likely to suffer complications. To add insult to injury, my husband still qualified under paid family leave to take time off for me to recover postpartum. But I didn't have the ability to take the time to recover myself. Think about that. For the past 3 years, I have been fighting alongside Push for what seems like forever to try to close this dangerous gap. This is money I will never receive, but I need to make sure that no other mother or birthing person is put in such a cruel and inhumane place in their darkest hour. The overwhelming response to try to change this law has been very positive from lawmakers. Both Democrats and Republicans agree that this is not a political issue. This is an issue of humanity. Yet, Assembly leadership has continued to roadblock our attempts to close this gap. Enough is enough. We need to reach out to our Assembly leaders and Governor Hochul and demand that this gap be closed through the 2025 budget process, whether it be through paid family leave or through increasing temporary disability insurance. We need to get the job done so that this cruel and inhumane treatment of stillbirth parents and birthing persons does not continue in their darkest hour. Thank you. And at this time, I would now like to pass the floor to Jessie from A Better Balance, who will be addressing the broader impacts of paid family leave and medical leave reform for pregnant families and all workers in New York through the Temporary Disability Bill A84, which is currently before lawmakers. Thank you.
Wonderful. So we did receive word that Vanessa Gibson joined, which will be standing by after Jessie, since you so eloquently. Oh, hi. Wonderful. Thank you for being here. I already introduced you. So feel free to take it away.
Thank you, Myla, and good afternoon, everyone. Thank you so much for hosting this very important press conference. I am standing in solidarity today with all of my Muslim sisters in the Bronx and recognizing today as World Hijab Solidarity Day. So I am so grateful to all of you for allowing me to be a part of this important recognition and this important conversation. It's an honor to be with all of you as we come together as a united front to truly address some of the most urgent issues that are facing our communities and right here in the Bronx. The maternal health care crisis that we are facing in the Bronx and in the city of New York. As the Bronx Borough President, joining my Deputy Borough President, who is a new mom, the Honorable Janet Baguero, we stand in solidarity with our Mobilize Maternal Health Coalition and all of you incredible leaders and advocates in this moment. As we know and recognize, African American and Latina women continue to bear the disproportionate weight of this maternal and healthcare crisis. It is a call to action and a call to attention. Our communities are enduring higher rates of maternal and infant mortality, complications during childbirth, and lack of access on vital healthcare services, prenatal and postnatal care. These inequities are not a coincidence. They are happening by design and on purpose because of systemic racism. We must call it what it is. A direct result of systemic racism and underinvestment, as well as in our communities of color and disparities that we face in the healthcare access and equity system. Maternal health has been a central part of our administration, of our blueprint, and we have fought for the passage of a number of bills, legislation at the city, local level, as well as the state level. As a former member of the New York State Assembly and a former member of the New York City Council, I know how it works in Albany, and I know how it works at City Hall. And so I fought and added my voice to make sure that we invest in reproductive health care services, ensuring that every woman, every birthing individual, regardless of where they live, how much is in their bank account, can live a healthy and productive and empowered life. This is why my office has been pushing our state to improve the Medicaid reimbursement rates to reflect the true cost of care in 2025, whether that is for doula services, prenatal care, postpartum care, mental health screening, diabetes care, preventative education, and lifestyle management, all critical, all services that are super important to the stability of our women, our birthing individuals, and their families. It is essential that healthcare services have the resources and the financial support, right, to make sure that we can deliver the best healthcare possible within our communities. I stand here today deeply committed and absolutely intentional in changing the disparities that we face today, turning our pain into purpose, our storm into strength, and turning our obstacles into success. Every woman, regardless of her race, her background, her zip code, deserves the right to healthy pregnancies, a safe birthing experience, and the best possible care for themselves and their children, our precious babies. The truth is, and the reality is, for far too long, the voices of Black and Latina women have been marginalized within the healthcare system, and that needs to change, and that must change now. All women, we recognize, deserve access and opportunity. The Empowering Reproductive Justice campaign, led by the Mobilize Maternal Health Coalition, is a powerful force for change. You all are doing amazing things, and I'm so grateful for all of you to call you friends and allies in this work, in this moment. Together with organizations, with our advocates, our healthcare professionals, our elected officials, we are taking bold steps to center the needs of the most affected communities at the center and at the forefront of our work. This campaign is not just about raising awareness, but it's about creating real, tangible change. We are fighting for policy reforms, legislation that will expand access to prenatal care, improve maternal health outcomes, and ensure that every woman, every birthing individual is treated with dignity and respect during and after childbirth. I take this moment to recognize and acknowledge the incredible advocates who I've worked with in 3 years serving as Bronx Borough President, who are doing this work in the trenches. Thank you so much to Myla Flores for your work, for the team, for the womb bus, which you know I love. And thank you to Miriam Clinic for serving our women today in the Bronx, to all the members of the Mobilize Maternal Health Coalition, to the reproductive justice organizations that are leading this charge. Thank you. We see you. We hear you. We empower you. We encourage you. We are strengthened by you. Your work is so vital. And together, as we fight for the future, as we fight for our women, let us be bold, let us be creative, let us be driven, let us be determined, and let us be intentional about demanding the fundamental change that we truly deserve. Thank you so much. I stand with you, and we are here
Thank
to work with
you.
Thank you, Myla.
You are so wonderful. Appreciate your passion and your support. And we will continue with the wonderful community members who are part of today's talk, sharing more about what they want to uplift. Thank you so much, Vanessa. Up next is Jesse Workman, who had been introduced by Cassidy earlier, and Bruce McIntyre will be standing by. Appreciate you. Hi, Jesse.
Thank you so much. Thank you for having me here today. My name is Jesse Workman, and I'm a senior staff attorney at A Better Balance, a legal organization dedicated to advancing justice for working families in New York and beyond. And I'm also a parent, and as someone who had a home birth in New York State, these issues are very close to my heart. Access to paid leave can help improve maternal and infant health outcomes by giving parents the time they need to manage their health needs and supporting families when their financial security matters the most. Right now, if you're a worker in New York and you need leave to care for a new child or a loved one with a serious health issue, you can take up to 12 weeks off, receive up to 67% of your pay, and have the stability of job security and continued health insurance. If you're that same worker dealing with your own serious health condition, which may be a complicated pregnancy or birth, cancer, or another condition, you get only a maximum of $170 a week. And that's a number that has been unchanged since 1989. What's worse, you could lose your job and health insurance coverage while you're out on leave. This unacceptable disparity exists because New York's medical leave program, called Temporary Disability Insurance, or TDI, has not been updated in over 35 years. And in that time, many states across the country have made comprehensive paid family and medical leave a right, but New York has fallen behind and left countless workers, including those with growing families, to make impossible choices. Through our free, confidential, and legal helpline, we hear many stories from New Yorkers with complicated pregnancies and traumatic birth experiences who, on top of that, are left scrambling to afford basic needs because our state's TDI program lags so far behind. Urgent reform to TDI is needed to address the maternal health crisis in New York, which, as Samantha described earlier, has a disproportionate impact on BIPOC women and families, and also to ensure that all workers can afford to take leave when they need it most. We are part of a large and diverse coalition working to pass these bills, which would bring much needed reform to New York's paid medical leave program, including raising the wage replacement rate to match paid family leave, allowing for intermittent leave, and adding vital job protection and continued health insurance. No worker should be forced to sacrifice their health for a paycheck. Our lawmakers need to hear the voices of all New Yorkers calling for the passage of A84 S172 now. And for more information about this campaign or workplace leave rights, including accommodations during pregnancy, please visit the resources that have been shared. Thank you.
Thank you so much for your work and you being in coalition with all the wonderful people who are uplifting this important bill. Next up, we have Bruce McIntyre, founder of Save a Rose Foundation, who I've had the honor and privilege of working with for years now. And Bruce, please introduce yourself, your work, as well as highlight the Grieving Families Act.
Of course. Thank you for having me. Satnam, everyone. Yeah, my name is Bruce McIntyre III. I'm the founder of the Save a Rose Foundation, which I founded after losing my life partner, Amber Rose Isaac, due to medical negligence throughout her entire pregnancy. And I jumped into advocacy immediately after her passing. So what we do at Save a Rose is we aim to combat and dismantle the systemic flaws within the medical system and redirect the course of birth equity towards better birthing solutions. I'm also a representative for the Justice for Grieving Families as well. And I also sit on the board for the New York City Council's Maternal Health Steering Committee as well. So I'm just going to talk about the Grieving Families Act as well and how it impacts families like mine. The Grieving Families Act is a legislation that it's about dignity, it's about fairness, and it's about recognizing the profound loss of families, of their experiences, and when a loved one's life is cut short due to medical negligence. For too long, New York's outdated wrongful death laws have valued loss of income over loss of life, denying families, especially those who are primary breadwinners, the proper justice. And under current laws, if a child or elderly parent or a stay-at-home caregiver is lost due to negligence, their families are not entitled to compensation for emotional suffering or financial loss, only for a bit of financial loss. The Grieving Families Act would modernize these laws by allowing families to seek damages for grief, loss of love, and companionship, recognizing that the person's worth is not just about their paychecks. The change would actually bring New York in line with 49 other states that are already recognized emotional loss and wrongful death claims. And that leaves you with one question, really. How many wrongful deaths are occurring in New York State hospitals for this bill to be seen as a threat to the state's financial stability? And so our call to action is, we've come so close to passing this bill. This bill just got vetoed by the third time by Governor Hochul. However, all of the representatives of this bill are very hopeful, and it is a very necessary and needed bill. So we are reintroducing it for a fourth time, hoping that we do get it passed this time. And of course, we're going to need everybody's voices. We need you to call your representatives and demand that they pass the Grieving Families Act and urge Governor Hochul to sign this bill into law, because it's necessary and it's needed. The only two laws that don't have a wrongful death statute like this is New York State and Alabama. Those are the only two states that don't have a bill like this. And it's time for us to catch up. New York is in dire need of passing this bill in order to protect families. Let's stand together and let's demand change, because no family should have to suffer in silence and no loss should be ignored. So thank you for your time. Thank you for your advocacy and your unwavering commitment.
Amazing, Bruce. Appreciate your work. There are so many people who are relying on this to pass. So all of you guys, I hope you're paying attention, and we're going to continue to uplift these things in upcoming teach-ins so that people can get significantly more informed about each of the issues. But for now, just wanting to continue introducing the members of our coalition, the supporters, the speakers. And up next, we might have a little gear shift right now in terms of who's next. And there's like a cross between two folks. I'm going to wait on word here. Sounds like when we say move Chanel, are we moving her to now or later? Is she in this? Is she standing by? Beautiful. Hi, Chanel. Thank you so much for being here in the midst of your travels and all the work that you're doing, uplifting the work far and wide. And you've been an anchor to so much of the work that has happened. And so I would love for you to introduce yourself and what you would like to share today.
Yeah, greetings, everyone. I'm excited to be here, and thank you, Myla, for inviting me to be able to speak today, to mobilize for maternal health and to push this birth justice movement forward. I think it's imperative, and I know that you all have heard from various different speakers today in regards to different policies and initiatives to center the birth and reproductive justice movement. What I really want to say, and I'll just keep it straight and keep it plain, is that now more than ever, we need one another. We need community, and we need to be strategizing for uplifting maternal health. There's a concerted effort to see reproductive health and justice fall by the wayside. There is a concerted effort to see the birth justice movement fall by the wayside, to see parents not be empowered around their choices. And this is the time now where we need each other more than ever, where we need to have a concerted effort to mobilize around maternal health, to really focus around what it means for us to center hope within our communities, because, it's easy to become distracted right now, but we know what's important for us and for our communities. We need midwives, we need CPMs, we need our midwives to be able to have accessible pathways to be able to support their community members. We need to know that folks need to be able to know that they can rely on doulas, and we have a solid Medicaid infrastructure. We need hospital-based policies and protocols that are really looking at how we're centering families, that are focused on accountability, that are focused on transparency, that are public facing. We need data collection that is also transparent, that is public facing, and that is consistent, so that we can continue to center an infrastructure of hope, but also an infrastructure that is stabilized through sustainability and understanding that when we invest in each other, we're investing in our community and we're investing in our future. And so I just want to thank you all for being present today. And again, we must continue to press forward to mobilize for maternal health. This is not a one-time event. This is not a one-time thing. This is an everyday thing that affects many different lives. And when we have one maternal death, we have multiple ripple effects, as my sister Shawnee Gibson has always said. And so onward and upwards in the movement. And let's continue to push our power to mobilize for one another.
Yes, thank you, Chanel. And that is so moving in terms of making sure that we keep the hope and move from that place of I'm going to say faith. If anyone wants to drop in the chat words that we need for ourselves and for one another right now, let's do that, because in terms of the mobilization that we attempt every day, we also are figuring stuff out as we go. And so I just want to acknowledge that whatever lane you're in right now, how you figure that out is imperative, that you do what you do. And maybe your thing isn't the policy or the actual service of families. What is your thing? And whatever you can do in your reflection, please bring that, because we need you, we need us.
Yes.
And next up, thank you. We have Solomon Acevedo, a deputy of the New York City Public Advocate in the Health Equity Committee, and has been supportive in showing up to some of our coalition meetings from jump. And so thank you so much for your presence. Feel free to take it away, Solomon.
Awesome. Good afternoon, everybody. Good afternoon, New York City. Thank you, Myla, and everybody who is working together in the Mobilize Maternal Health Coalition. It's really an important movement that really, for me, centers on what it means to recognize our humanity again and develop the right type of empathy that we need to actually build communities. And community starts with birthing people. And for me, I come to this work with lived experience of having 3 children, 2 who were born at home, 1 that was born in a hospital. And the experience of the difference in that care is super notable. And oftentimes we don't want to compare apples to oranges, which is what comparing midwifery to the traditional medical practice of birth and obstetrics in that way. The connections there come really from a different viewpoint of how we view people. And I think that for our office, starting from 2022, when we joined with City Council to pass a Maternal Health Bill of Rights, shout out to Vanessa Gibson, Borough President, who was moving us in that direction to support a way of looking at birthing people that is changed, and one that focuses on the marginalized experience of Black and Brown birthing people who are often neglected and whose voices are minimized due to the negligence of medical providers. I've witnessed that in my own experience, and I've got to see another side of the way people can be cared for when they're truly listened to and their desires are heard. And that's what I think is most important about the 6 pieces of legislation that are being promoted here today. We're talking about how to bring people the best quality of life that they can have throughout the birthing experience. And that can be something that is a celebratory way to have autonomous access to the things you want. And it could be something that is, erring on the side of tragedy when it comes to having true accountability for those actors who are negligent and providing families with what they need to be able to grieve and move forward when things aren't the way they had planned it to be. So we at the Office of the Public Advocate are committed to continuing to support the best ideas. Unfortunately, most of these pieces of legislation require state to move. And so we urge the governor, we urge the assembly, we urge the Senate to really get behind all of these pieces of legislation, which work cooperatively together to enhance maternal health. And if we don't do this today, we are on a bad road. So I urge cis men of color to also stand up, and birthing is a space where you too should be making your voice heard. And so again, shout out to the Mobilize Maternal Health Coalition for getting together and unifying for what is a time is now experience. Just like today is Rosa Parks' birthday, we too will stand up and make sure that people get what they need. So thank you so much for having me.
Thank you so much, Solomon. Beautifully said. So appreciated. And let's all bring that fire and energy behind our urge as we continue to urge our governor for the changes that we are bringing to the table now. I also want to give a brief shout out to the fact that we will have open calls in March. We're going to ask people who may know of other legislation that they want to bring to the table to share with us about it, so we can co-elevate and have a greater amplification. Next up is Trinisha Williams, who is a wonderful midwife here in New York City. She's also the president of the American Association of Birth Centers and is a home birth midwife working to open a birth center here in our city. And also will uplift information about a bill that supports midwives in supporting our community. All right, go on, Trinisha.
Thank you so much for that, Myla. I will be very brief. Thank you for all that introduction. We here in New York City think parking is a big issue for a lot of our midwives that are doing this community-based work, particularly trying to get to home births as well as in front of the birth centers that we do have established. And we have introduced information into the legislature in order to be able to allow midwives to get the same parking provisions as our colleagues that are EMTs, so that we could perhaps, when we're rushing to a home birth or rush into a birth center birth, have the opportunity to not have these red light cameras, as well as any parking tickets where we may need to be closer to sort of spaces that say no standing. And we really need this bill to pass. It is Parking Bill A1812, and we need all your help and support to call your assembly person as well as senator to ask for them to push this bill. I'll turn it back over to Myla. Thank you all for your support.
Thank you, Trinisha. Up next, we have a wonderful, also advocate, a wonderful clinician that I'm blessed to know, a doula, psychiatric nurse practitioner, women's mental health provider at Columbia. And you are here. I know you wanted to share about the role of birth centers in reducing trauma. And before doing so, I wanted to acknowledge some of the information that we had come across, knowing that birth dissatisfaction and adverse birth events can participate in the traumatic experience. And the data, according to the National Institute of Health, that many people, 45% of first-time birthing folks experience trauma and report some form of mistreatment, and that 1 out of every 3 people report feeling traumatized after childbirth. And so as you're aware, and maybe the other folks here may not know, but birth center births have doubled in the past decade, and evidence shows that people are seeking this option, even for the sole purpose of prenatal care. And this is something that our community is sadly missing out on until we change this together. But including the cesarean birth, the low birth weights, like all of the outcomes that we want to reduce, as well as all of the outcomes that we want to increase, like increased breastfeeding and all of these holistic ways of supporting our families increase. And so you, as a person who has direct experience supporting people who are in their mental health journeys in the postpartum, what would you like to share with the people today, Ashley, Dr. Ashley Butler?
Yes, thank you so much, everyone, for your work, and Myla for inviting me. You know, we know that client-centered birth experiences have the potential to reduce incidence of birth dissatisfaction and adverse birth outcomes, and also birth-related trauma. And midwifery and birth-centered based care fosters choice over mandates, discussions over directives, and autonomy over paternalistic approaches to birth. And while hospital births remain essential to the success of any birth system, is demonstrated in many developed nations with exemplary birth outcomes, an integrated approach, an integrated birth system offering both hospital and birth-centered based options supports a holistic, patient-first approach to birth, one which prioritizes and embraces choice, autonomy, and most importantly, safety. And as a perinatal mental health provider, I know all too well the lasting impact that traumatic birth can have on a birthing person. I've witnessed the ways in which trauma can interfere with one's sense of self, disrupt the dyadic bond between caregiver and child, undermine trust in healthcare systems and providers, unearth past sexual trauma, interfere with intimacy, dampen the joy of matrescence and parenthood, while acutely increasing the risk of perinatal mood disorders like depression, anxiety, psychosis, and post-traumatic stress disorder. Pregnancy and birth are transformative and humanizing experiences worthy of supportive options that reflect, dignify, and protect that experience. And birth workers, advocates, and midwives like yourselves are positioned to do just that. Let's continue to mobilize on all fronts to broaden access to equitable perinatal care throughout New York. And thank you so much again for having me.
Thank you so much. Speaking such important truth that more people need to understand. And so I know that next up we have a series of personal testimonials, Ashley, that really elevate a lot of what has been shared today. So thank you for joining us. And next up, I believe, is, let's see, is Stephanie Vidal standing by? Yes, Stephanie Vidal. Okay, beautiful. Stephanie is a mother and artist, had the privilege to work with her, and I would love for you to go ahead and introduce yourself and share your story.
Thank you, Myla, and good afternoon, everyone. My name is Stephanie Myla, and I am a mother and a visual artist. Like many families, I know the difficulty of accessing collaborative midwifery care out of hospital, but it should be an option for all New Yorkers. I was fortunate to receive the Birth Fund grant that allowed me a full spectrum care with the team at Miriam Reproductive Health and Wellness. It was exactly what I was looking for, care from people who were passionate about supporting families like mine. Throughout the entire span of time, my partner and I appreciated our experience of thorough support, compassion, and trust. During my pregnancy, I attended sessions on nutrition, I took birthing classes, and I received acupuncture and Reiki, and we prioritized doula care as well. Our team of professionals supported my family well beyond our labor and birth. I also received lactation support at Miriam Clinic, and having this type of wrapped around care for my first pregnancy was such a gift. I felt so confident and set up for success. The collaborative care extended beyond my team at Miriam. We had planned a at-home birth, but yeah, after a really long labor and care and consideration, I opted to transfer to a hospital. I continue to feel really supported with my midwives, and they helped to ensure that I had a seamless transfer to the hospital. They had a relationship with North Central Bronx Hospital where I was well received and birthed my baby girl with an amazing team of midwives. It was such a great experience. I felt so empowered, so informed about what I was going through, and it made such a difference for my family to be supported to the degree that we were. I hope more families can access this type of care. Thank you.
Amazing. Thank you so much, Stephanie. I too hope more people can access the kind of care that we all so want and deserve. Next up, I have Claribel Marmol, who is a midwife and has also a testimonial to share about her personal experience as a community member and midwife. Go ahead, Claribel.
Thank you so much. Greetings, all. It is an honor to be here in support of the Mobilize Maternal Health Coalition. My name is Claribel Marmol, and I'm a certified nurse midwife and a reproductive justice advocate. I'm a first-generation Dominican raised in the South Bronx, and it is an honor to be speaking as a healthcare provider, but also as someone that's deeply rooted in this community and has the honor to serve my own community where I was raised, and to serve the families that really helped to shape me into who I am today. In the Bronx, we know that access to quality care, and culturally responsive and holistic maternal health care is not a luxury but a necessity. So, the opening of Mariam, our collaborative OB and midwifery led clinic, is more than just a milestone for us. It is a commitment to ensure that every birthing person in our community receives individualized, respectful, and compassionate care. At Mariam, we are creating new systems where out of hospitals birth providers can really thrive and provide families with more options for personalized healthcare. Our approach is really rooted in reproductive justice, recognizing that true healthcare equity means centering the needs of those most marginalized in our system. In a borough where maternal health care disparities disproportionately is affecting our community, Black and Brown families, this is urgent and life saving. I stand before you today to uplift the voices of my community and emphasize the need for continued investment in midwifery led and patient centered care models just like Mariam. We have the answers and we have to act. It is our duty to create these new systems that really center us and serve us. We know that when we prioritize reproductive justice, we empower families, reduce disparities, and build healthier communities for generations to come. Thank you so much.
Thank you, Clarabelle. Thank you. Thank you. I'm loving choice over mandates. And next up is George Tierra, who is joining us from his vehicle. George, hello, welcome. You ready to go?
Yep, I'm ready to go.
Sweet.
I won't be looking at the camera. I apologize because I'm driving. My wife is actually holding up the phone for me, so I apologize. But everybody can hear me fine? Oh, did I lose everybody?
We can hear you great, George.
Oh, okay. Just making sure. Yeah, no, so my name is George Tierra. I'm a New York State paramedic and a recipient of essentially out-of-hospital birthing services. Very strong proponent of it, simply for the reason being that it seems like I'm chiming in a little bit on what Myla just mentioned, but I do believe in choice. I believe that the current system that exists with healthcare is not conducive to just having healthy maternal outcomes. I've worked in a hospital before, and I work as a paramedic now, and I can wholeheartedly say with the greatest enthusiasm that I really do believe that home birth is, as an option, should be as of right for individuals if they so choose. Unfortunately, we have a system that's heavily conflicted as far as interests go, primarily the insurance companies being negotiating their rates with big corporate hospitals that are for profit, and I think that's just not conducive to it puts us at odds with maternal outcomes. And so going on our second child now, my wife and I actually opted for a home birth this time. There's a lot of misnomers about that, but we're positive that and hopeful that eventually our politicians and the system as a whole will change to accommodate for those differences. And so I just wanted to chime in on that as the husband of a recipient of these types of services. I know that they have far better outcomes based on our research and our lived experience. And so I want to support this as best as we can, as I can. And I want to be part of that movement that brings about that change. with that, I'll turn it over to you, Myla.
Thank you so much, George, both for your service as a first responder and for sharing your experiences as a father. We have a couple of pre-recorded messages from some advocates here that we would like to share with you all today, before we move into the Q&A portion of our conference today. Please go ahead and drop any questions that you would like answered in the chat, and I will bring Myla back in a couple of moments to help answer those questions as best we can. So we are going to start first with a message from Jenny Josephs. Myla, do you have an intro for Jenny, or should I just let it roll?
Okay. Thank you. Sorry about that. So up next is Jenny Joseph, who is actually in DC right now with Chanel, in fact, and contributed a statement to share with us all. Let's take it away.
Good afternoon, everyone. Thank you for being here. Thank you for standing in the gap for New York birthing and parenting families who are demanding change, because we don't have time to wait. Black women are dying, Indigenous women are dying, our babies are dying, and it's preventable. We know the solution. The research is clear. The evidence is in. Midwifery care saves lives. Community-based midwifery care saves lives. Yet we are blocked at every turn. Midwives, the very people trained to provide safe, effective, respectful care, are locked out of the system. Aspiring midwives, especially Black and Brown students who want to serve their own communities, are denied access to education, denied funding, denied licensure, denied the right to practice. It is unacceptable. New York, it's time. It's time to stop playing politics with people's lives. It's time to invest in models that work, models that ensure easy access, cultural safety, and real human dignity. It is time to eliminate the barriers that keep potential midwives from training and doing the work they are called to do. So I ask you, will you stand with us? Will you demand that midwifery education be made accessible and affordable? Will you demand that New York create pathways for community-based midwives to serve? Because when we lift up midwives, we lift up mothers, we lift up babies, we lift up families. This is about justice, this is about equity, this is about life. New York, let's go.
Well, that was so incredibly inspiring. And we are so grateful for all that Jenny has done to just lay the foundation for empowered and just birth all throughout the world. The last message that we would like to share with you today before we jump to the Q&A is from Ashley Spivey, who is a fellow stillbirth mom. Sadly, she lost her son, CJ. She also lives in New York City. And one of the reasons that this coalition exists is because we know that change is possible. And Ashley has shared with us a pre-recorded message about some exciting news happening that just happened last month, actually, here in New York City, and which gives us hope that we can accomplish even more together. So let me put her on the stage here.
Hello, everyone. I'm excited to share an important update that's going to make a real difference for thousands of families in New York. Governor Kathy Hochul has officially enacted the Paid Prenatal Leave Act, ensuring that all privately employed pregnant workers no longer have to choose between earning a paycheck and getting essential prenatal care. This law is an absolute game changer. It provides 20 hours of paid leave for pregnant workers so that they can attend prenatal appointments without worrying about lost wages. It puts money back into the pockets of about 130,000 pregnant women each year. It also plays a critical role in addressing the maternal mortality crisis and preventing stillbirths. Studies show that without prenatal care, pregnant women are 3 times more likely to die from pregnancy-related complications, and their newborns face a 5-time higher risk of dying in infancy. Governor Hochul fought for this first-in-the-nation law, and it will expand access to life-saving prenatal care for hundreds of thousands of New Yorkers. If you or someone you know is expecting, be sure to take advantage of this new protection. I wanted to also quickly mention that PUSH has a Know Your Rights page on our website about these benefits and postpartum leave, which we plan to keep updated as other states hopefully follow suit. Check out pushpregnancy.org/rights for more.
Thank you so much. This is amazing. We are happy to be coming to a completion in terms of the speaker portion of this event. And I want to bring on any questions from the chat if we could read them aloud. I know there are a couple folks from the organizing team who are still standing by if you want to join. What I would like to share in closing is just amplification of our community and bringing it back to what Kimberly shared in the beginning, creating policy around people and being able to listen to the voices of who is right here today and the many people that we reflect and the communities that we serve. And hopefully we can continue to amplify some of the issues and lead in some areas, like, you know, hopefully people will take advantage of the paid postpartum leave, paid prenatal leave, and hopefully start to catch up in other places where we need to catch up. And so we hope and believe that we can integrate more policy with one another at the helm. And that might include the licensure and scope of practice when it comes to midwifery licensure and the birth center practice and the licensure issues that we have here, the payments, insurance coverage, payments for midwives, payments for birth centers. Chanel brought up earlier the data and transparency and accountability, having a maternal mortality or perinatal mortality review committee, ways that we can ensure that our peers and professional boards are accountable to the community, perhaps around billing. And then, of course, let's just acknowledge with workforce development and sustainability that there needs to be some state-based opportunities for school apprenticeships, preceptorships. The entry to midwifery training is a big issue for us here and part of what we want people to keep learning about. And that way, when we exist, and we do exist, but that way when we are legitimized and able to sustain our work, we can continue to move this work forward and reach the many people, like the families you heard today testifying about how they want the care that they've been receiving to be accessible to many. So we have a form to stay in touch. Check it out here, bit.ly/connect MMHC. Check out our website, which is mobilizematernalhealth.com. And we looked in the comments and we just see a lot of activity and shares and no questions. So thank you all. We do encourage continued, for those who are catching the playback, feel free to pop in questions and engage there. I want to, when I think of all the things we may have missed, I do want to just bring attention to one thing in particular, that there is a proposal on the governor's desk right now to support more birth centers in New York State in getting access to their properties or site control of their properties, or pay for support with the malpractice insurance piece, or navigating the certificate of need, which still proves to be an issue here. And so all of those are ways that some funds can be directed to the many birth centers that are seeking to serve families here in New York State. So again, thank you so very much. And again, whatever it is you do in your lane or intersecting with others or in community, keep up the important work. We're going to figure this out together, you guys. Peace and love.
Thank you so much, Myla. And just a quick reminder to everyone, everything that we have spoken about today is available on the Mobilize Maternal Health Coalition website. There are one-pager PDFs that you can download about any of the bills we've discussed, as well as one about the coalition overall, which summarizes everything. And we are just so incredibly grateful to everyone for being here today, to all of the amazing speakers who took time out of their busy schedules to come share with us their experiences and their perspectives. And yeah, thank you, everyone. Please use #PowerToMobilize on social media. As Myla said, don't hesitate to ask questions in any of the social media posts or the recordings. And this will be available on YouTube, Facebook, and LinkedIn for anyone who wants to watch it afterwards. Thank you so much. Have a great day.